Hello, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with the help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I am Naren Arulraja, the founder and one of the co-hosts of this podcast. Every listener to this podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Jessica Myers, who is mind strategist and founder of BU Bloom. She's also a certified hypnotherapist and emotional freedom technique master practitioner who aims to boost happiness, improve well-being, and enhance productivity in workplaces and our communities. Adding to her impressive portfolio, Jessica also speaks at prestigious ophthalmology events such as ASOA and ASCRS. The topic we'll be discussing today is emotional freedom technique, EFT tapping, for the well-being of doctors, staff, and patients. Jessica, let's jump in. Before we get too further down the road, tell us a little bit about yourself. Who are you? And of course, talk about your experience working with ophthalmology practices.
Sure. Thank you for having me. So I grew up in New York City and I graduated from Fordham University. And right immediately I went into the world of advertising. So my background's a little bit unique because right a few years later was when I moved to Los Angeles and I met Dr. Assil. And that was the first position as a patient counselor in the field of ophthalmology that I had entered, and that was nearly 20 years ago. And at the same time that I was doing that, I was also an actor. So I was on General Hospital. I was on shows like The Forgotten. I've worked with directors like Vin Diesel and Zoe Saldana. You probably heard of Ryan Coogler from Black Panther and Creed. So while I was acting, I was also a patient counselor for the patients. And at that time, my mom was entering into into Alzheimer's. So I realized I needed to really focus on caring for her, and I did. And so when I came back, I had a redirect in my life. And I decided that I was going to study human behavior, what changes thoughts and our thinking and how we show up in this world. So I entered a program for hypnotherapy, and lo and behold, years later, Dr. Assil, that very first surgeon, and I came back together, and I didn't know what was going to happen. And I became the director of business development, helped him grow the referral network again. And now I'm teaching holistic interventions to our referring physicians, as well as our doctors and eye surgeons.
Thank you. Really appreciate that. Let's jump into our conversation today. Emotional freedom technique for the well-being of doctors, staff, and patients. Can you talk a little bit about emotional freedom technique? What exactly is this? Just give us the 10,000-foot view on what it is, where did it come from, etc.
Sure. So EFT tapping, or emotional freedom technique, is a sequence of tapping points where you tap on the ends of the acupoints of the meridian system of the body. You see, the energy runs through the meridian system. We're all electrical beings, and it's based on the premise that when you have a negative emotion or a negative memory or event that still carries a charge for you, a negative charge for you, it hasn't been processed. It has not. It's looping in the body. And we do know in medical that energy disruptions in the body can break down organs and tissues. And so we want to make sure that our energy is optimized for health and well-being. And so you tap on these sequence of tapping points to give yourself sort of this tune-up and expose yourself to the presenting issue. And as you're tapping, let's say on the fear of water or the fear of public speaking, that tapping sends a soothing signal to the fight or flight response. And now you can process through that emotion and let it come out of the body and then restore that event properly. So same thing with PTSD and war veterans, right? They have shakes, tremors, insomnia, so many things that happen as a result of these triggering events. And EFT proved to be very, very beneficial for reducing or eliminating those presenting issues.
Right. What's the history of this emotional freedom technique? Where did it come from? When was it invented? Like, just give us some. I know doctors, I'm sure, are wondering,
Yeah, so Eastern practices, right? So we borrow a lot from the Eastern world to be complementary and an adjunct to Western treatments and things of that nature. And it originally was created for therapists and medically licensed professionals, but it was a little more complicated because you had to know what organ was connected to which point. And if you have a patient or a client in front of you that's distressed, that sort of might be hard to figure out. So an overhaul method, Gary Craig was part of that as well, was developed in order to make it easier for practitioners to implement much more easily and for patients and clients to tap on themselves. They can actually do it themselves.
Right. Now, you have been working, of course, pre-EFT with ophthalmology practices. So
Yes.
what kind of work were you doing with them? And what were some of your experiences as to why you wanted to bring this into ophthalmology?
Yes, I am still in ophthalmology, vision care, and I entered as a patient counselor and then returned as director of business development. So I work with expanding the referring network of optometrists that refer patients to us for specialty eye care like LASIK, cataract surgery. We do Eagle Vision LASIK. We're known for correcting the vision of professional athletes worldwide that travel to us. And so I thought bringing this into the practice would make sense because of especially where we are located in Southern California. Everyone is about health and alternative care, and how can we add that to our practice and treat the whole person, mind, body, and soul. So this made really good sense, especially since Dr. Assil has a master's in spiritual psychology, and Dr. Avneet Sodhi Gaur, she's the other partner. She even has an article on mindfulness meditation and glaucoma, lowering glaucoma pressures with mindfulness and those biomarkers. So it was a nice synergy.
Makes sense. So this is an ophthalmology practice. So is this
Yes.
like a separate paid service, or is this offered at no cost? Like, help me understand, how does it work from
Sure.
a
Yeah,
standpoint?
valid question. Yeah, so the way it works is, so before I came on board, I had literally launched my practice 8 years ago, and I was already trained virtually how to do it as well as live. So it wasn't a result of what had happened, obviously, in recent events. I had already been doing virtual. So when I proposed this to them, because of spacing reasons, it just made sense for me to continue to do it virtually. So they will refer the patients to me when they sense there's a distress or stress, or maybe they need help with executing the treatment plan. You know how hard it is to get people to do glaucoma drops? And we need to change those habits. So I'm also a certified hypnotherapist, and I can help with that in changing behaviors, changing habits, and how to reduce stress, for example, because stress, as we know, is the culprit of much of disease, right? Chronic inflammation. So
Thank you. So do you teach surgeons and doctors how to tap, or do you
yes.
actually tap with patients in a setting like a clinic, a in-office setting?
Yeah, and it's actually tapping with patients. You can tap on the go. You can tap anywhere you want, which is really, really nice. So in vision care, for example, like the exam rooms can be kind of small, right? So they can tap with the patient or just sitting in the chair. Patient comes in, and for us, we take a lot of time to get to know our patients very even personally. What's affecting them? Is stress affecting their vision? Is nutrition affecting their vision? That's important, right? So nutrition can affect the cells in the eyes even. So if a patient is stressed, sometimes they even cry because there's an overwhelm that they're dealing with, that they're bringing in that energy with them. In that moment, the surgeon or the optometrist can sit on that wheelie chair, come eye to eye with them and say, take a breath and let's start tapping, and tap on these acupoints with me as we breathe in and out. And you don't even have to say words, and it reduces that fight or flight response. And guess what? Usually their exam goes very well. They're able to even see more clearly because that stress response is neutralized.
Right. Right. And you have been doing EFT, you said, for 8 years, correct?
Yes. Yes.
And are there any other types of healthcare settings you have experimented with this, and what kind of
Yes.
outcomes are you seeing, or both in ophthalmology and in other healthcare settings?
Yes, and even beyond healthcare studies, actually. So what's interesting is that so when I present or talk about EFT or any holistic interventions at conferences, I'll get messages. And there's a hospital administrator in New England who tells me, he likes to tap under the eye. So I'm tapping right now under my eye for those who can't see. And that's connected to the stomach meridian. And that helps him before he has meetings with his medical team to reduce that anxiety. And that's helped him. I have optometrists or doctors who tap in the nurse's station or in between patients. So even for their own health and well-being, right? They do that as well. But I've taken it outside as well. So before I actually was bringing it into the medical arena, I was also teaching actors how to do EFT tapping through the Screen Actors Guild Conservatory program. They can tap for nerves, for public speaking, even for breaking down a character and how to connect with a character that is so different from you. It's a very unconscious process, so it reveals quite a bit. And then I also just a couple of months ago taught EFT to the leadership of the Council for Juvenile Administrators for Juvenile Justice. So they can tap with the youth that they served. And I also show them video of young adults who have been offenders, who are struggling with addiction, and how to tap on those meridian points to bring themselves into a state where they can make better decisions and break those addiction cycles.
Right. So is this like short? Is it like one session is all you need just to get started and see the benefits?
It can be. It can be. That's a very good question. It depends on the presenting issue and how layered it is. And that's why sometimes you'll see online, there's many EFT videos online, and you can tap, absolutely. But when the issue is chronic, when you don't feel like you're getting the results, it might be because you have it's called a polarity issue, where we need to reverse that chronic negativity. You've tried everything possible. You just can't get to the outcome you want. All of these positive practices, and you're still struggling or suffering. You want to work with an advanced practitioner, because many times there are aspects to that issue that you are not aware of, that we need to collapse those events until we get to the root and it shows up. And then we can tap out the root so that we can bring you back to that balance of mind and body and process the event. So I do recommend in those situations working with a practitioner. I've seen people have relief in one session, and then other situations where they've needed a series of sessions as well.
Makes sense. Can you maybe demonstrate for those of us who are going to be watching the video, maybe a few things, simple things, maybe not like complex, chronic, but just
no traumas.
No traumas. Yeah.
Yes. Okay, let's see. So public speaking is the biggest fear, even more so than dying. People are not as afraid of dying. So you would start on the karate chop point, which is like, if you visualize doing a karate chop, it looks just like that. And you start tapping there, and you would start with this statement that even though I have this fear of public speaking, I deeply and completely love and accept myself. So why do we say that? We say that because when the brain knows that you accept yourself just as you are, there are no conditions. You don't have to do anything. It sort of goes, okay, now I'm ready to change. It jumps on board. Now it's okay. It's psychologically safe. So, and then for those that are struggling, they may not say, they may say, I'm learning to love and accept myself. And you repeat that again 2 or 3 times. And then you go into the sequence. So, and you just say the presenting issue, the negative statement, you're facing it dead on, right? Like exposure therapy. So this fear of public speaking, and you move on to the next point, this horrible fear of public speaking, it's keeping me from moving forward in my career. Feels so debilitating. So you're rifting, right? And then you hit here on the collarbone point, this fear of public speaking. And then underneath here, this fear of public speaking. I like the anger point, which is under, right by the liver point. This fear of public speaking keeps me from doing what I really want to do. I am ready to release it now, this fear of public speaking. So you do sequences of events like that. You ask the client on a subjective units of distress, where are you? Oh, I'm at an 8. Well, let's see if we can bring that to a 5, and then bring that to a 3. And at 3, I like to give them a choice. I choose to release you now. I choose to be free of you. And then you can tap into the positive and the true for you and what's going to come forth. And it's a really beautiful process. Lots of tears sometimes, but it's really liberating. And last thing, you can actually tap on a heartache, this horrible person, and say the person's name and get them out of your system. So it works for small issues to very significant chronic issues.
Thank you. Now, what are some of your thoughts about, the future, and how perhaps, techniques like this, the emotional freedom technique, perhaps could help in the healthcare setting, and specifically in ophthalmology practices?
Oh, absolutely. I thank you for that question, because sometimes it's hard to see the logic connection how it connects. So let's take ophthalmology first, and let's take something like nutrition. So a person goes sees a doctor and they're having vision issues, and we can see if the person has diabetes, for example, and they're having issues with insulin. And this uptake in sugar is just overwhelming the good cells, right? And so the doctor, are they going to tell the patient, if you improve your nutrition, we would see improvements with this? They may not, because they know that they don't have the ability to help that person change that habit, right? There's only X amount of minutes that you're with the patient. So that's where they can refer the patient to me, and I can work on upgrading their nutritional habits. And I can use hypnotherapy and or EFT to do that. So that's one example. Another area in the medical arena would be in the field of neurocardiology. It's an exciting field, the relationship between the heart and the brain, and doing heart-brain coherence and optimizing the heart and the brain so that the person can get into a position of good, strong emotional management, and they don't have to act off of reactions. They can get into self-control and make better decisions for themselves. The heart disease is our number one killer. So if we can nurture the heart well and what's going on in that space, we can deal with those diseases in a much more holistic way, in addition to what Western medication provides.
Thank you, Jessica. As I bring this to a close, how can somebody follow you, learn more about what you're up to? Is there any resources we can share? And
yes, a way to get resources from me is to visit my website at bubloom.com. I also have a podcast. I have an episode on EFT and how you can utilize this for yourself if you'd like to listen to them. And that's on Spotify and Apple Podcasts at BU Bloom as well. And I also have a YouTube and Instagram at BU Bloom.
Perfect. It's BU Bloom. We'll put all this information.
Yes, BEYOU Bloom.
Right. We will include all of this information in our show notes. Thank you so much, Jessica, for your time today. I also want to take a minute to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, please share it with your friends and on social media. Also, please don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.
Are you ready to revolutionize healthcare with AI and technology? Join our free webinar with Dr. Anish Kapoor on November 1st, 12 p.m. ET, to learn how to use AI and tech for practice growth. Visit www.obacademy.org to register. See you there.